Summary: while evaluating the likelihood of alcohol and drug use within Company X and the cost associated with training employees, absenteeism, and damaged product, it becomes imperative that Company X implement a drug and alcohol policy. As noted within the goals section, this policy must include an EAP solution. The primary focus of the drug and alcohol policy will be to provide a safe workplace for all employees while providing avenues of assistance to employees that may be suffering from the drug or alcohol problem. The drug and alcohol policy must be implemented company-wide with specialized training provided to managers and supervisors on how to recognize substance abuse and what measures should be taken at the time of suspected incidents. Human resources will also be instructed on proper procedures that will need to be followed in documentation of substance abuse incidents. Recommendations: reducing employer substance abuse can help employees decrease healthcare costs, lower absenteeism of employees, reduce workplace injuries, and improve productivity. Programs and solutions are still available to help substance abuse. Substance abuse is not any different for any employer dealing with chronic diseases like diabetes, asthma, or arthritis. Both chronic diseases and substance abuse can be controlled successfully. It is not uncommon for a person to relapse and start using substances again. If this happens, an employee will need to start going back to their substance abuse program or find an alternate help. Here is some interesting facts. The relapse rates are similar for addiction and other chronic illnesses. On the vertical axis, percentage of patients who relapse, meaning they re-abuse substances. On the horizontal axis, chronic illnesses. The first one is drug addiction. 40% of Americans use drugs, and 20% re-abuse drugs. Type 2 diabetes, 30% of Americans start with, and 20% re-abuse. Hypertension, 50% start and 20% re-abuse. Asthma, 50% Americans start with it and 20% re-abuse. When identifying substance abuse early, employees may get help they need without causing their employers or companies much in losses. Our company's substance abuse benefits and programs shall include workplace policy, random drug testing, employee education / health promotions, employee assistant programs, and health plan treatment coverage. In conclusion, Company X is now fully informed and aware of policies which will be most beneficial to the company. Drug and alcohol policies within a company are essential to the smooth running and safety of all management and employees, and Company X has been referred to choose a policy which best fits within the characteristics of the company. In reviewing other company policies, there is no right or wrong, but to compare is not the way to go about choosing a policy for Company X. With the help of this study and recommendations, Company X must use this research and create a drug and alcohol policy that is solely made for Company X. In doing so, Company X will have a smooth running business with a decreased amount of substance-related accidents in the workplace, higher employee morale, loyal employees, safe and positive environment, and decreased costs. If Company S were to follow all the guidelines in the above report, a fair and stable policy can be enforced, helping Company X be a more successful in the end?